welcome back. I'm Dr. O, and today I'm going to be talking about taking advice from people that are healthy, not people that are still sick. What do I mean? A lot of times patients come in and they are telling me, you know, something that their girlfriend told them and why they don't want to go on hormone therapy, or why they don't want to use the weight loss method that maybe I'm recommending, or maybe not use the prescription or the vitamin or the herb or whatever it is that we might be talking about at the time. And I usually try to ask, where did they get that information? Like the reason why they're opposed to it. And a lot of times it's from, a girlfriend, someone in a group that they are part of, or someone that told them that they had a bad experience with something. And so because of that person's experience, they're going to generalize it and go, well, no, I don't want to do that either because, my girlfriend, thinks that the hormone therapy that she had is what gave her the cancer. And, as an example. So I tell patients that want to get healthy to be very careful of where they're getting their information, right? You want to take advice, health advice, from people that are actually healthy. I'll say that again. You want to take health advice from people that are actually healthy. There are way too many people giving advice these days, right? I mean, just turn on your phone and, is it TikTok? Is it Instagram? Is it Facebook? Is it, whatever social media is your preference that you go to. And someone on there is giving you advice on, what's healthy, what's not healthy, what you should be doing or not doing, right? But what is that person's credential? What is their training? How healthy are they, right? And think about that before you take advice from them. Because you have to kind of look at it in the same way we look at finances, right? We don't take financial advice from someone that's poor if you're trying to be rich. You find out what the rich people are doing and you learn that and do that, right? So we have to apply the same thing when it comes to health, right? I'm not going to take weight loss advice from someone that is morbidly obese themselves, right? I'm going to go to that person that maybe was once overweight and now has lost weight, and that's the person I'm going to talk to about advice on how to lose weight, right? I'm not going to go to that person that's never been overweight, doesn't even know what it feels like to have to lose 5 pounds, and then ask them for advice on how to lose 50 pounds, right? Let's get real. So the same thing applies to any aspect of your life. If you are trying to get healthy from an autoimmune disease, maybe go to that person that has suffered autoimmune disease, figure out a way to get healthy or get in remission from that autoimmune disease, and find out what they did, okay? And it's not just, oh, I read this. No, I tried this. This worked for me. This is the science behind it, and that's why I believe it worked, right? So let's be careful about where we get advice, is what I'm trying to say, okay? So to give you an example, if I've never suffered from thyroid disease and I go to someone that claims to be a thyroid expert and they give me their instructions of what I need to do to get healthy for my thyroid, and it doesn't work, would I be surprised? No. I need to go to that person that has suffered from thyroid condition, maybe the severe form of thyroid condition, like an autoimmune thyroid disease, and used a certain method, system, protocol to get in remission from that thyroid disease, and then I can take advice from that person, okay? So where this gets tricky is, how do you know if the provider, the practitioner that you are talking to has that experience? You just have to ask, right? Or they might have testimonials on their page. They might have other patients that referred you to them because they've gotten better from that. Or they might have that condition themselves and share their experience. So that's one of the things that I do with my patients. If I have gone through whatever it is that they are coming to me for, I share my experience with them. A lot of my patients know me as, you know, someone that's struggled to lose weight. And I have written a book on learning to lose weight, what you need to know to lose weight. And even after doing that, after writing the book on weight loss, I still regained weight, and then I had to lose it again, okay? So to give you an example of someone that, so now if I tell the patients, look, I understand where you're coming from, they know I know where they're coming from because I've been through it, I've struggled through it, I'm still going through it, okay? So losing weight is a journey, and that's one of the things that I've been telling my patients now, that it is not a quick fix. Yes, you might be able to do a quick fat diet that's gonna get you to lose a few pounds, you know, for an event, for this, for that, but that's not sustainable weight loss. When we have to live a healthy lifestyle for a long time to really keep the weight off, a lot of us struggle as life hits us, as stress hits us, as we manage our business and balance our work, family life, right? As we become caregivers for our, you know, family, our parents, our spouse, or you know, or our kids, or become a soccer mom or basketball mom or whatever it is that, you know, life throws at us, right? We find that we have to have people that have gone through it that can then guide us, because otherwise we're just grabbing information from random people, random places, most of the time sick people themselves, giving us advice on what we should do to get healthy. And the same way we do not take advice from poor people on how to get rich, we really should stop taking advice from sick people on how to get healthy. I hope that rings in. Be very careful of where your information is coming from. And even when you read the information online, always think back, why is this website giving me this information? Is there an agenda? Is there an underlying reason? Who is the sponsor of this research that I'm reading, right? Because that's another area that we find that patients get confused. You know, you pull up a paper and it's claiming that this is the latest study on a topic. And because it's a scientific study, you believe it right off the bat. But there are criteria on, you know, study design and things that should be in place that this so-called study might not have, right? It might be biased. There might be sponsors that have, you know, paid the investigator for that research to release the data that you are now reading and taking as gospel. So a lot of times when I'm reading this information, I'm asking myself, what is the underlying reason? Why is this person sharing this information? Why are they saying coffee is now the best thing, or coffee is not the best thing, right? Are they trying to sell me a tea bag? You know, like, so you have to also consider that and take the information with a grain of salt, and always look and say, who is sharing this information? Have they gone through what I'm going through? Have they come out on the other side healthier, right? Before I apply what they're telling me to do to my own health, to my own life, okay? Hope that makes sense. And if you have any question about this or any tips on this to share, please leave your comment in the section below. I will be looking at that and answering the questions.